So hello everyone. Today we'll be discussing Jamia Milia Islamia Mpt entrance syllabus. Okay. So this MPT entrance examination it is based on the curriculum of BPT followed by various university. It's not like that only Jamia Milia Islamia BPT syllabus will come. It's based on the syllabus of all over India. So the topics under each subject is mentioned below, and the subject or the syllabus is not limited to the particular topics. Okay. So as you can see, first we have human anatomy. Here we have tons of topic. You can just go through it, or you can take screenshot, like definition of anatomy and anatomical position, cell tissue, topics related to osteology, arthrology, myology. Okay, and next we have human physiology. Here we have uh, topics like cell, its function, morphology, then membrane, nerves, muscle physiology, mechanism of contraction of skeletal muscle, then physiology of nervous system, cardiovascular system, lymphatic system, respiratory system, digestive system, endocrine system, urogenital system, reproduction system, means all the systems you will get the in exam. Okay, and this deep sea diving physiology, it's very important. Next we have biochemistry. As we know, in biochemistry we have vitamins, minerals, proteins, carbohydrate, lipids, nucleic acid, what is like metabolic homeostasis, then some biochemistry principles like application of ion exchange, chromatography, HPLC, electrophoresis, homogenesis, ELISA, enzyme kinetics. Then some questions will come from genetics. So just go through the topic, take the screenshot, and prepare according to these topics. Okay. Next we have microbiology. Here are some basic concepts. Okay, like germ theory, Koch's postulates, microscopy, preparation, then staining of specimen, the structure of cell wall, chemical composition of cell wall, then immunology. Then we have pathology. In pathology, these are the like most common questions in pathology, which you even get in university exams, like classification of lesion, inflammation, cell injury, cell death, adaptation, tissue, cell repair, hemodynamic, then systemic pathology affecting cardiovascular system, respiratory system, nervous system, endocrine system, alimentary system, and urinary system. And next, the sixth subject that we have is pharmacology. Here we have some general pharmacology questions like pharmacokinetics. Okay, it's drug routes of administration, dosage, delivery system, mechanism of drug action, biosafety, drug toxicity, therapeutic index, all the topics. Then we have drug acting on autonomous nervous system, central nervous system, respiratory system. Then NSAID, antibiotics, chemotherapeutic agent, and all the things related to drugs which are used for various human diseases. Next, we have biomechanics and kinesiology. In biomechanics, we have kinetics, kinematics, plane, axis, muscle, tendon, bone, ligament, then biomechanics of different joints of human body, then biomechanics of gait and posture. So this gait and posture I have already discussed in detail in my previous video, and also general biomechanical principle. The two videos I have posted already, so you can go through those and you can complete your basics. Then prosthetic and orthotics, that is prescription of orthotics, then prosthetics, then footwear modification. So I have started I'm going to start PMR series, lecture series. Soon you will get, so keep subscribed to the channel and you'll get all the videos related to all these topics. Then exercise therapy. So in this, there are lots of topics like mechanical basis movement, skeletal basis of movement, okay, then fundamental and derived position, classification of exercise, active, passive movements, then motor learning, biomechanical modalities, goniometer, manual strength MMT. Okay. Then muscle re-education, PNF, mat activities, then exercise testing. So if you don't get like any notes on any of the topic, you can just comment below. I will make a notes and post on it. And if you want, I can even take classes on some topics. Then we have strength and endurance assessment training, balance coordination assessment training, gait and posture, ADL, traction, suspension therapy, hydrotherapy. Related to these two, hydrotherapy and suspension therapy, I have already posted notes on Instagram page. So you can go through that. For gait, video is already available. So you can just check the Mind Academy channel. Next, we have electrotherapy. Here we have electrical activities in muscles and nerves, application of energy to the human body, then properties of electricity, AC, DC, electrical component, transformer, rheostat, semiconductor, conductor, capacitor, the electromagnetism, electromagnetic radiation, therapeutic modalities, and the application like cryotherapy, laser, infrared, UST, IFT, Faraday, galvanic current, SWD, MWD, LWD, combination therapy, socket therapy. And 11th subject that we have is PT in orthopedics and rheumatology. Here we have like medical and surgical management in orthopedic and rheumatoid condition, then role of diagnostic tool, physiotherapy, orthopedic assessment, general physiotherapy approach towards trauma, classification of fracture dislocation, principles of treatment and complication, management of fracture, general pre and post-operative assessment, management of most common surgeries, then some developmental disorder, then assessment and physiotherapeutic management of the bone and joint infections, signs, symptoms, common sites, assessment and PT management of some rheumatological conditions like OA, RA, fibromyalgia, psoriatic arthritis, pseudo-gout. Okay, and then next we have a review of the condition, assessment and management and treatment goals and the plans for conditions like rotator cuff injury, periarthritis, anterior capsulitis, bursitis, tennis elbow, golfer's elbow, then some pulled elbow, etc., wrist and hand, periganglion, decurvence, trigger thumb, finger, CTS. So all these topics are there. Just have to make a notes on it. And if you don't get the notes, just comment below. I will prepare notes for you. Then we have some knee deformities, osteoarthritis disease, loose body, anterior knee pain, chondromalacia, OA knee, foot, ankle, anterior foot pain, heel pain, tarsal tunnel syndrome, then spine, thoracic outlet syndrome, torticollis, PIVD, spondylolisthesis, strain, lumbar canal stenosis, spondylitis, and ankylosing spondylitis. Then our 12th subject, that is PT in general medicine and surgery. So we have medical and surgical management in the condition other than the orthopedic neurological disorders. Then etiology and symptom science along with clinical physiology management of the following conditions like transplantation, liver, kidney, nutritional metabolic disorders, diabetic mellitus, physiotherapeutic techniques like postal drainage, manual technique, percussion, vibration, shaking, breathing exercise, post-expiratory technique, coughing, huffing, supported coughing. Then etiology, symptoms and signs along with clinical and physiotherapy management. Then dermatology, assessment of skin condition. Then classification and characteristic of common tumor, edema, inflammation, gangrene. Okay. Then PT management of some common pediatric conditions, then pre and post-operative physiotherapy management and complications. Then general surgery, okay, types of surgery, type of incision, then anesthesia and its complication, hernia, its type, abdominal surgeries, obstetrics and gynecology, so pelvic floor, prenatal, postnatal programs, postal training, pelvic floor stretching, strengthening, then physiotherapy during labor, PT management in menopause, deconditioning, PT management in common gynecological surgeries, role of PT clinical reasoning for application of electrotherapeutic modality, then review of the pathological changes and principles of pre and post-operative management of physiotherapy in following conditions. Then we have wounds, burns and plastic surgery, medical and surgical management of burn. And then we have PT in sports injuries. So here topics are like medical and surgical management in sports injury, sports medicine team members, then nutritional consideration, protective sports equipment, environmental factors and sports performance, body composition, special consideration for female athletes and endurance consideration for adolescent, preventive aspect of sports injury, exercise consideration for special population, basic concepts of periodization, athlete evaluation, emergency care, and on-field injury. Then we have sports traumatology like spine injury, assessment management, then shoulder joint complex injuries, elbow joint, wrist joint, hand complex injuries, hip, pelvis, thigh, knee joint complex injuries, foot, ankle joint complex injuries, then exercise and sports physiology. Now we come to PT in cardiopulmonary disorder. That is medical and surgical management of cardiopulmonary conditions, then physiotherapy technique like breathing exercise, respiratory muscle training, PNF respiration, humidification and aerosol therapy, then ventilators, airway clearance devices, airway clearance technique, selection of airway clearance technique, positioning and mobilization, and ACBT. It is like very important. Almost all the time question comes regarding the ACBT. Then cardiovascular physiotherapy assessment, investigative procedure, cardiac rehabilitation and secondary prevention, etiopathogenesis, clinical and physiotherapy management of conditions like congenital heart disease, PDA, VDAC, physiotherapy, ischemic heart disease, and pulmonary physiotherapy assessment of pulmonary system, investigative procedures, then etiopathogenesis and management of obstructive pulmonary disease, infection, neoplasm, interstitial pulmonary disease, disease of nasopharynx, larynx, trachea. Next is physiotherapy in cardiovascular pulmonary surgeries. Okay, types of incision, pre-post-operative assessment management, the cardiac surgery indication, contraindication, incision, pre-post-surgery management, and its complications. Then thoracic surgery, then we have physiotherapy in intensive care unit. This part, physiotherapy in ICU, this is like very well described in a video that is shared in this channel. Just go through it. Okay, it's like 3 hours long video, but once you go through it, you will learn almost everything about ICU that's important that may come in exam. Okay. Then PT in neurological condition. So medical and surgical management in neurological and psychiatric disorders, then neurological assessment, then techniques of neurological physiotherapy like NDT, roots, PNF, motor relearning program, biofeedback, FPS, Bernstrom approach, then etiopathogenesis, clinical manifestation, and physiotherapy management of neuromuscular diseases like MND, peripheral nerve diseases, cranial nerve disorders, then infections, disorders of nervous system like encephalitis, meningitis, poliomyelitis, demyelinating disorder of CNS, multiple sclerosis, then neoplasm nervous system, there is brain tumor, and congenital and developmental anomalies. Then we have inline all the topics mostly. That is metabolic and toxic disorder of the nervous system, cerebral disorder, movement disorder, cerebrovascular accident, spinal cord injury, traumatic brain injury, cerebral palsy, vestibular disorders, disorder of autonomic nervous system, then ICU management of neurologically impaired, pre and post-operative physiotherapy management, and nutritional deficiency affecting nervous system, toxin, drug-induced nervous system pathology, and physiotherapy management of psychiatric patient. And I think we have these two, CVA and spinal cord injury. These two we have in our YouTube channel, so you can just check them if you feel okay. And if suppose we don't have any one of these, we have I think in our channel. And which one you want, you can just DM or comment. We'll try to prepare notes for you. Then PT in community-based rehabilitation. So that is community medicine, introduction to community medicine, healthcare system screening, preventive medicine and public healthcare practice, healthcare education, community rehabilitation. It's multidisciplinary approach. Then rehabilitation approaches, there's socio-legal aspects, rehabilitation, national, international agencies, and rehabilitation is special care like visual, speech, communication, hearing impairment, physically challenged, mentally challenged. Okay. And then research methodology, biostatistics, and ethics. So in most of the places, I think in bachelor's level, it is not taught. So if you are not taught this in your syllabus in PPT, so just go through some basics PPT that you can get, or if you are confused, you can just DM me or comment below. I will try to share the PPT regarding this basics one, which will help you in exam. Okay. So importance of research in physiotherapy, research ethics, clinical issues in research, element of informed consent, structure of research proposal, research methodology, research problems, questions, hypothesis, review of literature, measurement, principle of measurement, reliability, validating, experimental sampling and design, and descriptive research. We have a collection of data, sampling method, variable which is discrete to continuous, presentation of data, classification and tabulation, then diagrams and graphs, bar, pie, histogram, line graph, concept of statistical population and sample, characteristic of frequency distribution, measures of central tendency, mean, median, mode, weighted arithmetic mean, then measures of dispersion, that is range, quartile deviation, mean deviation, standard deviation, correlation and regression, test of significance, t-test, chi-square test, and ANOVA, and then ethical principles applied to moral issues in healthcare, rules of professional conduct and scope of practice, relationship with the patient, relationship with the profession, confidentiality and responsibility, professional and government licensing, accreditation and education standards, and laws and legal concept, role of WHO, WCPT, safety precautions in physiotherapy. And then we have topics from psychology. Okay, there is nature and branches, method psychology, learning, its nature, theories, classical and operant conditioning, insight learning, emotions, nature and relationship with autonomic nervous system, theories of emotions, memory, stress, intelligence, altered state of consciousness, difference between normal and abnormal behavior. So these are the like topics, just go through them. Then anxiety disorder, somatoform disorder, dissociative disorder, mood disorder, disorders of childhood, substance abuse, old age and brain disorder, then psychologically based therapies. Then we have sociology, which is definition, sociology as science, basic concept, institution agencies, society, culture, health, major determinants of health, health and disability, development and social problems, concepts. And then we have environmental science. Okay, it is like environmental pollutions, absorption, distribution, elimination, and organ toxicology, membrane coefficient, mechanism of absorption, rate of penetration. Okay, just to go through this topic because in most of the places, environmental science is not in bachelor's. Okay, I think it's in Utkal University syllabus, but it is not in WBHS syllabus. So you read it accordingly. Then bioaccumulation, biomagnification, biodegradative, non-biodegradative substance, acute and chronic toxicity, dose-response relationship, and all the topics are here. So just go through it. And then business administration. So general administration, planning and organization, planning cycle. And then financial issue, including budget and income generation, hospital management, self-management, describe method of administration in physiotherapy. So basically business administration is that how will you manage an organization? If you're working in a hospital or in a clinical setup, how will you manage everything? Then we have maintenance of records, referrals, and store keeping materials, inventory records, purchase, ordering, petty cash, accounting, general maintenance equipment. So that's it. Thank you very much. So you can see there are total 21 subjects. You have to cover 21 subjects. And I think only by exam is on May, right? 2 months are there, so it can be done. Okay, just try to cover all the topics and solve as many question paper as you can. From next week, we will be starting solving the last 5 years of Jamia Milia Islamia question paper. So we'll try to solve at least 2 to 3 by in next 2 months. Okay, so do subscribe to our channel, and thank you very much. See you all in the next video.